Hi, Dr. Daniel Hockenberry here at Ried Physical Therapy. Today I'm going to be going through some frequently asked questions, and today we're actually going through knee pain specifically, so we're going to be kind of talking about that area. So often one of the questions I get is, why does my knee hurt, especially when I'm going up or down stairs? This is something that's most usually indicative of something called Patellofemoral Pain Syndrome. What that means is that the actual patella, so the bone on the front of our knee, is actually not gliding the way it's supposed to be. A pretty common injury to the knee we tend to see, especially stairs being a problem area for them. Whether that person was very active prior, or they had just had a procedure, or they were sedentary for a long period of time, those things can actually factor in. But more importantly, what can factor in is actually that the way that the patella is tracking up and down tends to be the thing that is really causing them the pain. We most often see it with stairs being the biggest issue. So kind of some of the ways we treat that is actually teaching their body to be able to track the patella properly, whether there be some tightness in the tendon itself that attaches, or the tendon above it that attaches to the quadriceps, as well as that their quads may not be firing the way they should be, so we're not getting a proper contraction in the areas we need to in order to get that knee to pull directly up. As well as that, we may be lacking strength when we're going downstairs, for example. We call this an eccentric strength, to be able to control the amount of flexion that is actually going through the knee, actually leading to some pain there. So what can actually happen over time is, if this isn't really treated, the surface underneath the patella can actually start to wear and actually disrupt the way that the knee joint itself is moving. A couple other factors that actually can be part of this is whether it be improper footwear, an imbalance lower in the body, or an imbalance upper in the body. So we're talking about the ankle or the hip. There are a couple things that can actually lead into this area being kind of part of the problem. This is usually something that we use actually to rule in after we assume that nothing else is wrong with the knee. So we'll actually check everything else out, and then this is kind of something that we go ahead and go through a couple of tests here to make sure that this is really the area that we need to be focusing on, but really making sure when we're diagnosing that we actually take a look at the joints above the knee and then the joints below in order to really get the full picture as to what may be going on with something along the lines of patellofemoral pain syndrome.